holy moly, do we have a lot to talk about. Well, hey everybody, welcome back to my channel. I am super glad if you guys came back to join me in this. If it's your first time coming and joining me on my channel, then I hope that you'll hit that subscribe button down below, and that way you'll join the family, or you'll join my journey if you're clicking on this video for my skin removal and my panniculectomy after having had weight loss surgery. So I am finally with you guys. I've got a big old thing here because we're going to talk about my pre-op appointment. I am going to break this up into my pre-op appointment, and then I've got a video that's got a Q&A. You guys asked all kinds of questions on my Instagram that I'm going to answer and probably touch into a lot of stuff like how to get insurance to cover it and all of that. But I just simply want to specifically talk in this video about the pre-op appointment, maybe some questions that you should have for your pre-op appointment, and just how it went and exactly what it is that he is going to be doing for me. First off, it was a long little appointment. It was just long because I want answers, I want questions. I want to make sure before you cut into my body that I know every little nook and cranny, and do not be afraid to be an advocate for yourself, no matter how people may seem or if they seem annoyed. This is your body and you're about to let somebody transform it. Somebody cut into it. So you make sure that you know and you are comfortable with everything that is about to happen. I do want to say that first and foremost is don't ever feel like this is just routine doctor stuff and that you just sign papers and you just go on willy-nilly. You need to make sure that you read what is going on. You need to make sure you're asking the questions, getting on the same page, and that you are walking out of that office knowing exactly what is going to happen to you. Be ready for it to take as long as it needs, quite frankly, because and they should be understanding of that. My office was very understanding of it. It was a pre-op appointment that took an hour and a half, and they did not act like they were annoyed. Even if they were behind closed doors, they didn't act like it to me, which is great, customer service wise, because like I said, I think they understand it. You know what I mean? You're about to cut into their body, all of that you need to know. So for the pre-op, at least at my office, they're going to give you a huge old stack of papers that's going to have everything from exactly what you're about to have of your procedure, all of the complications, the risks, taking care of yourself afterwards. It has paperwork for my drains that I will have after surgery. And so my first suggestion would be obviously to read it. I'm not going to show you guys the front page just because it's got some personal information on it. But so you're going to get things like this that are your pre-surgery instructions for my panniculectomy. So it told me things that I needed to do 3 weeks or more before surgery. So practice proper fitness. So basically, I mean, it's things that make sense, you know? It's like, okay, yes, go ahead, work out, like make sure that your body's in good health. Don't I'm sorry, I'm reading something and I'm kind of laughing because I tried to do this and it was already immediately like a no and I stopped it. But it's saying good nutrition, eat well during the weeks prior to surgery. If you didn't know, I'm somebody who switched to a Mediterranean lifestyle, which is already pretty clean eating, really good. I had something which I'll talk about in a little bit when he talks about risks and complications. For me, I was like, oh my God, I need to lose weight. And so I decided to try to do the pre-op diet like before I had the gastric sleeve, and I immediately got sick, was not doing well. It's almost like my body immediately crashed, and not in a healthy way. And I was like, I can't do this. So I went back to eating a pretty balanced diet, Mediterranean lifestyle, which is healthy and clean to begin with. And I'm like, you know what? If the scale's not going to move, it's not going to move. But I just felt like crash dieting was not going to be okay. And as this tells you, crash dieting is not okay. They're going to go over the medications that you're going to have. So medications, for me and what I'm going to be going through is I am going to get an antibiotic. I think everybody should get an antibiotic. Also, you're going to get pain meds. I'm getting pain meds. For me personally, I am somebody who struggles with nausea since having the gastric sleeve. So there's a prescription that I'm going to get and take before surgery. It's called Amend that I guess they're going to write me. And it's something that helps. It's like a pre-thing. So that you take it before you get surgery, and it kind of helps to combat so that you don't have that nausea as bad after surgery. So I am going to be taking that medication before I have surgery to help combat the nausea, because Lord knows I don't want to be sliced open and then dealing with some aggressive vomiting. I'm also going to get an anti-nausea medication, which I requested for as I recover, because I'm somebody who pain medication, things like that, can again be harsh on my stomach. So I did let them know that even with the gastric sleeve, any procedure I've ever had, I've only had two, which is the gastric sleeve and my wisdom teeth taken out, but still I needed nausea medication. I get very nauseous, so they are getting me a prescription for nausea as well. It does give you instructions on what you need to do 1 week before surgery, and so it does say something that I found kind of interesting for this particular procedure, because a lot of it is your typical stuff of like, you know, confirm your surgery, make sure you have your prescriptions, but then it also does talk about that you need to wax or shave your bikini area and legs. It may be uncomfortable to do so in the days immediately after surgery. I have heard in my group and stuff as well that like surgeons want you to be like waxed or shaved and stuff like that due to where they're making the incisions and like putting stuff together. But I've also heard too, you don't want to do it too close to the surgery, because then if you nick yourself or anything like that, you have a risk of infection. And then obviously that's a risk of infection even with the surgery. Luckily for me, I'm somebody who I get laser, so I shouldn't have a problem when it comes to my bikini. And when it comes to my legs, to be quite frankly, like, I don't care if I have hairy legs. But then it also talks about the things that obviously you need to look out for, which would be the infections, fevers. Like a lot of it is very, very like, this makes sense. They went ahead and gave me my first post-op appointment and the time, which is 3 days after I've had surgery, that I'll be having my first post-op appointment. I don't shower or anything after the surgery. I don't shower until I see him. So I'm going to be kind of just sponge bathing and trying to keep myself real clean beforehand and not be so stinky. But I will see him 3 days after my surgery, and hopefully he'll tell me that I'm cleared to be able to shower. It does talk about how I'm going to, so 6 weeks following surgery, because this is something that although you might have an initial period of time where you heal, this is a very long healing process. This is not something that's like, it's like the sleeve. So if you've had the sleeve, you know that yes, maybe our incisions and different things might have healed within the first 3 weeks or 4 weeks, but that doesn't mean that we were all of a sudden great to go 4 weeks out. Your stomach took about a year in order to really truly be at what it's going to be at, which is kind of like how this is. So it says even 6 weeks following surgery, you may ease into regular fitness. So I'm not going back into body lifting right away, obviously. And like it said, it's saying that, you know, you need to realize that your body's going to probably take time to get its strength and things back. Still will have discomfort or tightness, and tingling of the skin will start to resolve, but that's still 6 weeks out. But it talks about just even the first year. So that's where, like I said, your surgery is something that could be a year. It does say that a 1 year post-surgery follow-up is recommended, but you can also just like call the office. That's the downside here, is I will not be here a year out. So that's why I'm getting mine done pretty much ASAP, because I want to be able to allow myself as much time here with the surgeon who did it before I have to be on a plane and I'm overseas and I can't just like pop into the office. I'm going to do things like signing your informed consent. So here's the thing that I did. Informed consents, it had multiple pages of things in terms of the information, the risks, and I would go through, and if there was anything that I had questions on or anything of the sort, I would put a question mark. And I made sure not to sign the back sheet until I had my questions answered and I knew exactly what was what. So this just talks about, it is literally this much information of, kid you not, risks and complications and things that can occur with this surgery. So this is a major surgery, you guys. This is not something to be taking lightly. This has me definitely a little bit more concerned than even the gastric sleeve, and the gastric sleeve I was freaking out about. So if you can imagine, I've got some anxiety, but I'm excited as well. But I did, like I said, make sure to go through, look at everything, and then sign. So including also being a plastic surgeon's office, it did ask if I was okay to have like my pictures for them, and them to videotape my procedure if need be, which, hello, I'm on YouTube, so obviously I didn't care about that. But maybe that's something to also make sure that you're reading about, is in case you're somebody who's like real hush hush, that you're like, no, if you don't want your pictures out there or potentially out there on the internet or anything like that, make sure you're reading that stuff and you're not signing it. Or you're letting them know, like, no. We talked about how to care for my drains, which is going to be a whole ordeal, and I think I'm going to actually make a video after I've had the surgery, everything like that, to really show how to do what they said, stripping the drains, dumping the drains. My surgeon does not want me dumping my drains more than once a day unless it has to be, which I actually really like. It's less risk of infection, because every time you kind of open that drain and you're doing it, you're letting the potential for infection happen. So I like that he really only wants you to do it once a day, unless obviously it gets full to where you need to dump it. Showed me a drain, and she gave me like an example, but I kid you not, it was basically like, like, I'm not gonna really get it, I feel like, until I have it. They also gave me my log sheet that I will have, which is for my drains, to be able to log also the amount and everything that'll be in the drains and what needs to come out. And that was basically the gist of what your pre-op is going to look like. But let's talk about some of the in-depth and things that I personally went through, personal questions that I had. So the first question that I would say you should probably have for your surgeon, you've got approved, you're going back in, you're at your pre-op, is again making sure to ask, okay, what are the realistic expectations that I need to have, and what are you going to do? Because it's really easy to start to, like for me, join this group, right? There's all kinds of people getting this procedure. It's really easy to start picturing all of these people and thinking that that's what you're going to look like. It's really easy to start imagining, well, is this going to happen to me? Is this going to happen to me? Nothing's going to clear up anything until you are with your personal surgeon, and you and your surgeon are on the exact same page of the exact thing that they're going to do to you. I'm going to go ahead and stand up. I'm going to show you exactly what he showed me that he is going to be doing to me, and then we'll come back. Okay, so here is my stomach. Here is my hanging stomach. So if I turn to the side, you can see here how it hangs, where it goes down. So like he said, he's going to make an incision from pretty much my hip all the way under to the other hip. He's going to literally lift, well, he's going to also cut around, sorry, I forgot to say, he's going to cut around my belly button, and then basically he's going to take this top layer, he's going to lift it up to the breastbone, he's going to take out the fat and things underneath, and then he's literally going to pull down from my breastbone to my hip bone and staple me back together. Pretty crazy, isn't it? So it's pretty intense. It's called an extended panniculectomy. I want to first off say that an extended panniculectomy is not standard for everybody. A lot of times the panniculectomy would have only been the incision underneath my belly button and only taking that part out. He's doing an extended one. We'll talk about insurance coverage and some of the things that will happen with plastic surgeons for this. But let's just say I really lucked out with having a really, really great plastic surgeon that is also a perfectionist. And that is the thing that I would say, if you can find that, go ahead and do that, because technically, no, I should not be getting the extended. It should just be under. That's what's medically necessary. But my plastic surgeon, even the way that he's cutting above my belly button, it's because he's like, I hate seeing just the hip to hip cut. He's like, here's what it's traditionally supposed to be. He's like, I'm not doing that because I don't like how it looks. So again, my plastic surgeon is a cosmetic plastic surgeon. He does do insurance, but he is looking at it and cosmetic wise as well. No, I'm not going to look perfect. I'm not going to have some Kim K belly. I'll tell you about the little things that he told me are going to happen with my body, but for the most part, I am happy at the fact that he is going to try to make it look as aesthetically pleasing as he possibly can without doing the added things like lipo and all that kind of stuff. But that's not traditional, and I just want to say that of panniculectomy right now, or even for every surgeon. The other thing is with your belly button. Typically, if you are somebody who's doing an extended panniculectomy, you will lose your belly button. He is somebody who just is giving me a new belly button. He's repositioning mine because, again, he's like, I mean, unless for some reason I didn't want a belly button, he's going to give me my belly button. A lot of people will talk about that they will not get their belly buttons or they have to lose their belly button. So again, that's something to look at when you're looking at plastic surgeons, or if you're really debating on if this is something that you're going to do with insurance or out of your pocket, is if you are looking for only going under the knife maybe once and you're just trying to get as best as you can, but you're not willing to make certain sacrifices like losing your belly button, or you don't want to just get the bare minimum cut and still have the potential for a roll, then you really need to look at, are you willing to either pay out of pocket for the difference? Are you willing to pay out of pocket in general? Do you need to wait until you have the surgery? Or really taking the time to see if there's a plastic surgeon out there who accepts your insurance, who's going to do the little bit extra for you because they look at you like a piece of artwork and not just a surgical procedure, if that makes sense. So one of the things that he did tell me when it came to my procedure and the outcomes and what I should expect is that when you run your hand over my stomach, that basically where I have the incision, because the skin where it was pulled out is so thin and he's pulling obviously thicker skin down, I'm gonna almost feel like a ridge, which he said the only thing that can take that away is if I had lipo. We even asked what would lipo be out of pocket, but he said he will not do lipo in this procedure because it's so much that he's already doing. My body would not take lipo. Like, he was like, that would just be too much. So I was glad too that he was out for my safety and my concern. I feel like sometimes that's another thing, is if a plastic surgeon's willing to throw you under the knife and do all kinds of things to you, that might be a little bit alarming, because you really want them to have your health in mind, and yes, also your outcome, but obviously your health should come first. So I was glad to see that he was like, nope, I would not do this even if you paid for it. It would be too much. But he said that it's something that I won't see. So he said that when you look at it, you won't see it. He said it's just if I ran my hands over it, I would be able to feel, which for me, that's really not that big of a deal. When you've had such a big pannus like I have my entire life, to feel a little ridge is probably going to still be magical to me, to be honest. That's not a concern. The next thing that we did talk about though was if I did come, to make this as cosmetically perfect as possible, because he said basically that if I came back in a couple months and did what he would recommend is 360 lipo, kind of around the love handles and stuff like that, he's like, it'll just be like perfect, right? So he's like, I hate when it looks like you've had surgery. So what I'm thinking in my mind, what he means is, yes, I'm going to look like one of those people where he's cut it down. I'm going to probably still kind of have some love handle. Like, that's a little bit off, right? But if I did the lipo and things like that, he makes it so perfect where it almost just looks like you. I'm okay not looking like it was me. I'm okay that I got plastic surgery. I'm somebody that you guys know. If you follow me on my Instagram or anything like that, I accept who I am and what I am and what I've done. So for me, I have no shame in the fact that I went under the knife to take away the skin and remaining fat after I've had my weight loss. I don't care. Like, you can judge me if you want, have your opinions. It's my body. So I'm okay if it's not looking perfect. I just wanted to make sure though that I'm not going to look like jacked, that continuing my fitness journey, it's going to get all wonky, which it sounds like it's not. But obviously, you know, we'll see with you guys following along with me in this journey. But it sounds like it's really not, like with me getting with my fitness. And it's not like I'm going to all of a sudden get this and I still want to lose like 100 pounds. I want to get this and I really want to tone up and I really want to build my muscles and really body build. So for me, I don't really see too much of an issue in my stomach. Next thing though that we did talk about is, of course, weight. So as we all know, yes, I lost a great amount of weight, but my BMI is still not to what standards would be. I am supposed to apparently weigh, he was like, you know, if you were closer to your ideal body weight of, you know, about 110 pounds. Yeah, I'm never weighing, 110 pounds is like my thigh. So I am never going to be 110 pounds, but he was talking about that I am putting myself at greater risk of having complications, needing to heal longer, bleeding, all kinds of stuff because of the fact that I am essentially still an overweight person getting this surgery. He did tell me that if this was not medically necessary and I was just coming in as a person who wanted this cosmetically, he would not do it. So that should give you a perspective as to why I also have some of the anxiety, is the fact that yes, like, okay, you're telling me that you would not do this cosmetically, you'll do it medically, and I'm at higher risk, but I feel like, and I know at the end of the day, and my heart tells me, if this was something that was putting me at such a substantial risk and all of this kind of stuff, he just wouldn't do it. Do you get what I mean? Like, he would just say no. So I think it's just kind of more, and I asked the nurse after, because like my mom was in there and she was of course then freaking out when she heard that, and she was like, he has had people who've been your weight, over, like bigger than you, everything, you know, it's kind of more of the spiel and what he has to say. So I'm like, okay, I'm okay with that. So I know that I have that risk, but I also know that at the same time really taking care of myself, and with my pre-surgery clearance, that I'm a healthy of enough person that I really feel like I should be good. I feel like I'm not going to be somebody who, after the surgery, they told me about the garments that I'll have to wear. I'm not going to be like taking those off to just like look at my stomach a ton. Although I know I'll want to, I know that my healing is going to come first, and I don't want to have complications, if any, that are especially due to me post-surgery. Hopefully it's in God's hands that I hope that I will be okay, but I feel like I'll be okay. I hope I'll be okay, but that is something that was told to me. So just know that if you're somebody who you're similar to me, if you're overweight, this is not something that if you do think you're going to go and get this done cosmetically, you will probably be denied. With the pre-op appointment, it's kind of that last hurrah, you know, you're seeing your surgeon, that's it. We did last minute payments of some things. So my garment that I decided to get, they're going to give me a binder, but there's a garment that's kind of like Spanx, that's a medical one. And I asked, I was like, okay, is this something that I could get on Amazon and be okay? Or do you really recommend this? And they were like, the nurse was like, really, or do you recommend this one? Like, yes, there's the ones on Amazon and everything, but this one and the way that it is, I recommend it. So I did have to pay for that garment. It's $80. They measured me, so it is going to be to particular measurements that I'll have after surgery, which either they'll put on me right after surgery, or I'll be able to put it on like the next day or something. But it's a compression garment that'll kind of help to hold everything in and keep me from swelling and all that jazz. So that was basically the gist of my pre-op appointment. I met the nurse who is usually in the operating room with him. She's like, there's really no reason I shouldn't be, but that was nice to already know who my nurse is. Obviously, we talked about anesthesia. Everything that's pretty typical to surgery we talked about. But like I said, the biggest thing that I would suggest that you ask is realistically setting the expectations and knowing with your surgeon what is going to happen for you and your specific body. If you have any questions about your medication, so like I said, making sure, like for me, I get the nausea, that I had that medication. Also making sure that if you are doing this through insurance, that all T's are crossed, all I's are dotted, because you guys, this has been the biggest pain in my behind when it comes to doing this through insurance. I'm not going to lie. Like, I'm very, very grateful that I'm getting it done through insurance, but the amount of calls and things to make sure that everything is going to go off without a hitch has just been kind of crazy, kind of annoying, but I'm glad that it's coming to an end and hopefully is going to be just smooth sailing from here. Yeah, guys, we're almost there. We're getting along. We're going along in my journey, and just thank you guys so much again, those of you guys that have been on this journey with me since my weight loss and getting weight loss surgery, and here we are to what I feel like we're finally going into like the final chapter of this. So it's very exciting, it's very bittersweet, but I can't wait. Again, I thank you guys so much for your support, and I can't wait to see you in the next video. Bye.